Truncus arteriosus, what does it supply? It supplies the right upper lobe. Then with regard to the development of the pulmonary artery, it is mesodermal in origin, not endodermal. Where does the deep groove of the aortic arch basically lies? The deep groove of the aortic arch lies superiorly along the mediastinal surface of the left lung is what need to be remembered. With regard to the pulmonary ligament, the pulmonary ligament is not a true ligament, but it is a reflection of the parietal pleura is what you need to basically remember. Now with regard to the costodiaphragmatic recess that you are seeing, it is basically a potential space that is found in the pleural cavity into which the collection of the fluids can occur at the time of the effusion is what you need to basically remember. We invite our online students, Shilpa and many more. Now, mediastinum. Typically, what is the wrong statement about a mediastinum? Mediastinum is a central thoracic compartment and it contains the various organs is what you need to basically remember. It's not fat filled is what you need to understand. Now, inferior mediastinum, what are the various divisions? So, there is a anterior, posterior, middle, but not lateral mediastinum. So, my examiner asked in anatomy, Viva was, where is heart? Sir, heart is in chest. Very humble answer. Oh, we are thinking it is in abdomen. Huh? So, like examiners are like, they will rough you out. So, to add to the confusion, actually it is a abdominothoracic structure, sir. He said, don't go into further blundering. I just asked which mediastinum is the heart. Now, with regard to the middle mediastinum, what is accept? So, thymus is a part of the anterior mediastinum, as all of you know very well. Now, in posterior mediastinum, you don't see phrenic nerve because phrenic nerve is a part of the middle mediastinum. And the various boundaries of the posterior mediastinum, inferiorly it is bounded by the thoracic surface of the diaphragm is what you need to basically remember. At the level of the thoracic plane, what are the various structures? All this but not left recurrent laryngeal nerve, which is the part of the superior mediastinum. Coming to the superior mediastinum, which is a boundary. So, thoracic inlet superiorly is considered to be the true boundary is what you need to appreciate. With regard to the thymus, thymus is located in the mediastinum in the thorax is what need to basically remember. It's a silly question. No one will think thymus is in abdomen, in renal fossa, even if you have a coma also. So, this kind of questions are also given in exam because to see whether you are writing or a robot is writing, right? Now, what is this histological structure? The cortex is staining darkly in this histology. So, which is the classical feature of thymus gland. Remember, one of the lymphoreticular gland histology will be given. Lymph node, thymus, spleen, lung, adrenal. How to recognize them histologically? You should have a clarity in image based questions. Now, what is this on histology? It looks like a Lucknow chicken sari border, but it is basically a lung which is having a fine lace like appearance on the histology. Now, what is this? Typically, it is a case of hormone acting upon itself, which is autocrine signaling. And on the adjacent cell, you basically call paracrine signaling. And typically, via bloodstream at a distant site is endocrine signaling. And typically, the hormone is a neurotransmitter, so it is a neuroendocrine signaling. And in this picture, what are the various structures which are labeled? This is Singer-Nicholson's model, which is called the fluid mosaic model of cell membrane. And the part which is being labeled B is basically the phospholipid. And the part which is labeled B in this diagram is glycoprotein. And in this, the one labeled B is basically integral protein. So the labeled part B, in this, what does it depict? It depicts peripheral protein. So the cell membrane is made up of a lipid bilayer with a lot of proteins. You have 1, 2, 3, 4 different proteins. So what is the order in which they are there? Ion channel, surface antigen, receptor, adhesion molecule. They are the typical components. Now what is this phenomena basically? It is the endocytosis where there is an intake of particulate material. And what is this diagram? This is typically a receptor mediated endocytosis, receptor mediated clathrin coated pits, etc., that happens in the liver, in the lipid metabolism, is a receptor mediated endocytosis. So what does this diagram basically show? It shows us transcytosis where across the cell membrane there is a transport. And what is this diagram basically? This is a exocytosis where the movement of the matter is occurring from inside out. And in this you have got a diagram and what is the chronological order in which this action potential generation basically occurs. So the secondary active symporter, the other is secondary active antiporter, the second type. The third type is an example of a passive channel. So primary active transport utilizes ATP. And what is secondary active transport? It is like this. In a family, elder sister studies very well and she writes beautiful notes. Entire night she burns oil, hard working, gets seat in MBBS. His younger brother does very little effort. He just reads the notes written by elder sister and crack a better rank than the elder sister. A lot of times it happens like that, right? So the first elder sister who did all that effort and utilized her ATP is primary, and the younger brother who read her notes and passed out by the gradient created by her is secondary transport. That's what you need to appreciate. Now a 5-year-old boy, coarse facial features, clouded corneas, restricted range of motion of joints, elevated serum hydrolase, that is the important clue. Typically whenever elevated serum hydrolase is there, you call it as eye cell disease. And the eye cell disease fundamentally problem is that the Golgi apparatus is what you need to appreciate. Now what is Gilchrist disease caused by? It is caused by the broad-based yeasts which are formed by the blastomyces is the one which causes that. Then large friable polyps, as what you can see here, are the typical feature which you see with rhinosporidiasis. Then this kind of a wedge-shaped perforation is caused by which dermatophyte? It is basically called, what test it is called? Hair perforation test, where you inoculate a colony into a petri dish containing water, yeast extract and hair, and the fungals pierce the hair and it produces a wedge-shaped perforation, which is then called as a typical hair perforation test. This kind of a Reynolds broad phenomena, where do you see? With which fungus? Typically with both Candida albicans and also tropicans, Candida species. Grape-like clusters, as what you can see, what is the organism? So it is a staphylococcus which is being arranged like a grape-like. Ideally, we should not give all this description. Lot of these MCQ setting teachers, they don't know how to frame the question. Their idea is correct. So we need to train them how to frame the questions. So we are trying to find some first year, second year postgraduates who are the recent NEET PG takers. They are the ones who can create more and more tricky questions because they pass it through the similar phenomena. So I also request you to send some image based questions to add to the flora. So laser based technology, where do you use? This one. So it is a flow cytometry which is used in both cell counting and cell sorting. And this kind of reaction, where do you see? Typically it is a super antigen which is bound non-specifically to the T cell receptor, and it causes a massive non-specific cytokine release, which is the underlying pathophysiology that can explain the toxic shock syndrome is what you need to basically remember. So what is this condition basically? It is an example of a cellulitis which is caused by the staphylococcus. Now a GBS is being streaked perpendicular to Staphylococcus aureus. What is this test called as? Christie-Atkinson-Munch-Peter. It's Christie-Atkins-Munch-Peterson test, CAM test it is called as. So the phospholipase which is being produced by the GBS, which causes a synergistic hemolysis with the beta hemolysis caused by Staphylococcus aureus, is typically called the CAM test, is what you need to basically understand. Bile solubility test as what you can see here. Once more, Dr. Microbiology, all these tests you should be 100% sure. So uMedico app is having the video library in which you have microbiology. In that you are having Streptococcus, Staphylococcus, different culture methods. All those video lectures are available. You can happily consume them, right? Bile solubility test is done basically for the pneumococci is what need to be remembered. The CSF from the patient is showing the gram staining cocci in pairs. So this kind of a feature typically is caused by the meningococci, which are the diplococci, which are lens shaped, is what you need to basically remember. So I am very happy to see 8 people, Priya and many more who are all online. Thank you. Once upon a time we used to have about 150 online, 150 in the classroom, huge classes. But nowadays a lot of times what happens is students take the test at their own leisure. And in the uMedico app you can get a ranking. And your rank keep changing as the new people keep taking tests. So that's the reason, take the test at your convenience with the modern app-based mobile tests. That's what is uMedico for NEET PG preparation. You all have the uMedico app downloaded, right? If you have not, please download now, and our people will give you a free access to the mock tests. What is a likely clinical disease in this patient? So basically it is a papillobacillar rash on the hand, foot and mouth, which is basically caused by enterovirus. Tryptic soy agar shows golden yellow colonies in the plate. So golden yellow, golden is aureus, aurum is a name for gold. So Staphylococcus aureus produces non-diffusible golden yellow pigment is what you need to remember. The KOH preparation is showing abundance of yeast cells and short branched filaments. So what is your diagnosis? So it is pityriasis versicolor, which usually involves a stratum corneum, and spaghetti meatball appearance is what you typically see with malassezia furfur is what need to be remembered. What is this oval inclusion body in the cytoplasm of the neuron? It is the Negri body which is typically seen. And what is this non-bile stained egg that you are seeing? So it is Enterobius vermicularis, which is plano-convex, double layered, non-bile stained egg. Plano-convex, double layered, non bile stained egg. Once more, you will have in all our notes and everywhere what are bile stain, what floats, what doesn't float, all these things about parasites, ova, cysts, you should finish, otherwise lifelong you will become a microbiologist, be sure. So, endemic relapsing fever is caused by all these organisms except the Borrelia recurrentis, which causes epidemic relapsing fever, is what need to be remembered. Brazilian purpuric fever is basically caused by Haemophilus erysipeus, is what you need to remember. Gastroenteritis virus, which can spread by air, which one it is? It is the norovirus. Even aerosols of the virus inhaled can settle in the pharynx, later swallowed, leading to gastroenteritis. Immunocompetent individuals, fungal infections can happen, and that would be candidiasis because it's a part of the normal flora, and it can be altered whenever you are taking antibiotics. So, though you are immunocompetent, still you can have candida. Don't suspect every candida as a case of HIV. Now, pathology questions are really good. They are all truly image based questions in true spirit. A 26-year-old man presents to the physician with anemia. The peripheral blood smear is typically shown, and it is serocytic, hereditary serocytosis. There is an increased mean corpuscular hemoglobin concentration. And how will be the Coombs test? In hereditary serocytosis, hemolysis is not autoimmune mediated. Serocytes unable to pass through the fine spaces in the spleen get broken down. Typically, Coombs must be negative before you call it as hereditary serocytosis. Hereditary serocytosis is a typical Coombs negative, non-autoimmune hemolytic anemia is what you have to basically remember. A young couple trying to conceive for more than 1 year, and this is the histological portion of that part of the testis where the sperm acquire its motility, it finishes its housemanship and become mobile. So, which part is this? It is typically the epididymis, which is lined by the pseudo-stratified columnar epithelium with stereocilia, is what you need to remember. Now, 53-year-old is on dialysis, and while awaiting the kidney transplant, the nephrologist said, I have given you pioglitazone, and a renal biopsy was done, and this picture came out. What is this picture? Nodular glomerulosclerosis. You can see the nodules forming, right, with all the thick material getting collected inside the nodular appearance. So, which is very typical of diabetes. 35-year-old, right flank pain with fever, urine microscopic examination is being shown to you. And what is the most prominent cell type that has infiltrated basically? So, they are all WBC cars, hence they contain polymorphonuclear leukocytes. 54-year-old with a heart murmur came with fatigue, and there is a late diastolic murmur, and the S1 has become fainter. Cardiac biopsy has been shown to you, and what is the histological finding? So, this is the typical histological appearance of a Ashkoff body which is containing Antishkoff cells, is what you need to basically remember. The adrenal tumor, pheochromocytoma here. So, from where is it derived from? It is derived from chromaffin cells. 68-year-old with postural instability with resting tremor, and the neuropathology has been shown to you. And mutations in which protein will lead to this condition of this patient? So, basically what you are seeing is a Lewy body, and alpha synuclein is the one which is underlying factor which is responsible for the production of the Lewy bodies on histopathology is what you have to basically appreciate. A 48-year-old comes with chest lightness, shortness of breath, and has history of high blood pressure. Father died out of heart problems, and which myocardial abnormalities is likely to be seen on the light microscopy 8 hours after his symptoms. So what do you have here? He is having acute MI. So what are the changes that occur within 8 hours, 24 hours, 48 hours, 72 hours after MI? Robbins pathology, you have got a beautiful diagram, and that you have to remember. A lot of times questions are asked. So contraction bands are the ones. So type of necrosis in myocardial infarction is coagulative necrosis. 4 to 12 hours you see dark mottling, then depressed infarct border which is red grey in 10 to 14 days. More than 2 months you will see the scarring which is complete, etc., etc. Some of you are going to become top cardiologists within a period of short time. So you must be well prepared, and a lot of students who were sitting like you, taking the mock test, thinking, wow, is it like this? Today, when I meet them, I say, wow, you are heading the neurosurgery department. Wow, that's a wow feeling they give back. And that is what, as a teacher, I always enjoy in this little life where there was an opportunity given by God to become teacher for many. So, with one single dream, you should prepare. You should prepare that if your dream branch is general medicine, if your dream branch is pediatrics, dream branch is orthopedics, every day you should wake up and feel, this is the juncture of my life where I am going to set the bones correctly. Within a short period of time, another 6 months or 4 months, and fill the gaps where you are missing, and then the day when you are topping entrance, you will say, oh, I know this about a month back itself. This is going to happen. Don't tell when you fail and I know very well this is going to happen long back. Not for failure, for the success, I am saying. 30-year-old complaining that her blood pressure was high, and sodium is 160, which is high. Potassium is low, and blood pressure is high. So from which area of adrenal gland? It's a case of Conn syndrome, hyperaldosteronism, and aldosterone from the zona glomerulosa. 68-year-old with a back pain, with a fatigue, comes to the emergency department with anemia and bone marrow biopsy done, and you see lytic lesions in the skull, you are seeing plasma cells in the bone marrow. So typically it is a case of multiple myeloma, and the problem is, if you look at the cell architecture of a plasma cell is identified by abundant rough endoplasmic reticulum is what you need to basically appreciate. 65-year-old has got a heart attack, admitted, ultimately dies, and the heart muscle is being taken, that infarcted area. So after 1 hour, this finding is found. So what is this? I mean, when is this finding found? What you are seeing in this histology is neutrophilic infiltration. So acute neutrophilic response to acute myocardial reaction takes a maximal period of around 2 days to happen. That is what examiner allowed to know from you. Decreased secretory activity of these cells indicated in this image. Where do you see? Typically in pernicious anemia. So this is a typical histological finding of the parietal cell classically.